Well, hi there. My name is David Coletto, and I'm the CEO of Abacus Data, a full-service market research firm with offices in Ottawa and Toronto. I hope everyone is doing well. I know this past year has been a real challenge, and I hope everyone is staying safe and making the most of this very challenging period. I am excited to be here today to share some research that we have done on behalf of the Canadian Dental Hygienists Association. The survey that I will share with you was done in mid-January. We surveyed 2,000 Canadian adults, and really the objective was to understand what impact the pandemic is having on people's proclivity to get dental care, and what some of the barriers were, and those who have sought care over the past 11 months, whether they felt safe and satisfied with the experience that they had. But before I get into those specific results, I did want to share some research that we have been doing on an ongoing basis, exploring how Canadians are feeling about the pandemic so that you can understand the context by which these results that I'll share with you later come from. And so I'm going to get right into the presentation. And I think the key takeaways of what I want you to think about today are that when we did the survey in January, not surprising, the pandemic is still in focus for many Canadians. Anxiety levels, as I'll show you, are close to the highest they have been throughout this period, and fears about getting the virus, fears about the hospitals and health system capacity being overrun, as well as some financial concerns by a sizable minority of the population, underscore how people are feeling. But the results suggest two things from your perspective. First, some patients are delaying visits for dental care. We did research back at the beginning of 2020 for the CDHA that showed about 2/3 of Canadians typically get some form of dental care annually. That number, at least in the course of the past 10 to 11 months, seems to be down. But that those who have sought dental care in some form, particularly those that have seen a dental hygienist, generally feel safe, that experience was safe, and that the overall experience itself was not very different from what they would typically experience. So some good news coming from this survey. But as I said, I want to start with the context. And the takeaway from this section is that Canadians remain quite worried about the pandemic. We've been tracking this right from the beginning, and that green line on your screen represents the percentage who say they are not worried or not at all worried, or only a little worried about the pandemic at any given moment, whereas the red line represents those who are feeling most anxious about it, those that report being extremely worried or worried a lot. And you can see that over the course of the last few months, into the end of 2020 and the beginning of 2021, that red line has remained quite elevated. Anywhere between 36 and 41% of Canadian adults report being quite anxious about it. We hadn't seen that level of anxiety since the beginning of this pandemic. So the second wave of cases, the rise in the number and threat of additional variants coming into the country, has created for a sizable minority of Canadians a deeply untroubling period. On the other hand, there remains about 1/3 of the country who don't feel that threatened or worried so much about the pandemic. While there's not much demographic differences or regional differences, we do typically see that older Canadians, women, are more likely to report being worried and anxious about this pandemic than those who are younger and male. But the differences aren't that great, and there's a general sense of concern that divides the country going forward. Now, when we ask a little more detail about what is making people concerned, what we do find is that for the most part, fear of getting the virus itself has grown substantially since June. You can see a 15 percentage point increase. June really represents the low point of public anxiety. It's when the case numbers were the lowest across the country. as of January, when we did this survey, case numbers were really peaking. And so half of Canadians report being concerned about getting the virus. Even more, 65% report being worried about a family member getting COVID-19. That's up 21 points. Now, all of this concern about the virus and its impact goes beyond just my here and now and the feelings of getting this virus. There's also broad concern around the capacity of the health system. 63% are concerned about there not being enough hospital beds. 57% are worried about there not being enough medical equipment. So we've heard stories around, whether that's routine or medical procedures being postponed because there's a lack of hospital beds, is something that has really focused people and is one of those external impacts that has people worried not only that if they were to get COVID, would there be care for them, but also if they were to come down with another illness or an emergency, would the system be there to respond? And it's something we're monitoring quite closely. The pandemic has also obviously had an economic impact on millions of Canadians, whether it's that they've lost their job, reduced hours, lost dental coverage or health benefits. We haven't seen a sizable shift from June until January on many of these measures. You can see about 1 out of 4 Canadians report still being concerned that they might lose their job or their job will disappear. 41% are concerned about their long-term financial situation, and about 1 out of 4, just over that, are concerned about paying their bills day to day or month to month. Now, in all cases, these numbers are elevated than what we would normally find, not to a great degree, but it does underscore that this recession that the pandemic caused is not being felt equally across the population. Folks like me who've been able to work from home have not been affected at all. In fact, there's a sizable minority of Canadians who report being financially better off today than they were. We see huge amounts of savings. Canadians are saving more money than ever before. And so there's one segment of the population that is financially secure and not really worried about the long-term effects. And then there's a sizable group, I would suggest around 20 to 25%, who have been affected quite deeply, and that shows up in our results. So the overall picture is one in which, as this second wave hopefully starts to dissipate, we should also expect to see this anxiety decline. And there's obviously a relationship between your level of concern, the risk perception that you have about getting this virus, and your willingness to do things that you perceive to have some risk of exposing you to the virus, and going for a dental checkup or a cleaning or some other form of dental care is one in which people don't perceive a high degree of risk, but some risk, as opposed to just staying home and not doing it. So that's the next section. And when we worked with the CDHA to come up with a number of questions we asked on our survey in mid-January, we really wanted to understand who was being affected, how behaviors might be changing, and what are some of the barriers to those that have not visited dental hygienist in the previous almost year now since the pandemic started. The first point is to note that about 4 out of 10 Canadian adults report having gone to a dental hygienist since March 2020. I'm one of them. I've actually had 2 cleanings and gone to see a dentist for other procedures since that period, but 57% report not doing it. And when we try to understand, is this higher or lower than what we would normally see, my best estimate is we have seen a decline in visits over this period. Typically, as I said, in a survey we did in 2020, right at the beginning of the year, before the pandemic really started, Canadians reported in a survey we did for the CDHA that about 2 out of 3, or 2/3, typically visit a dentist or a dental hygienist annually. And so given that we're almost at that 1-year period, this represents a substantial decrease in the number of visits. So there are a number of Canadians who might normally have gone to see a dental hygienist who are not or haven't yet done that, largely, as I'll show you, because of concerns about the pandemic. Now, when we look at the demographics and socioeconomic factors that might be influencing it, we don't see big regional differences, about the same number, slightly higher in Ontario than in other regions. But we do see one across socioeconomic status. So lower income Canadians typically are less likely to see a dental hygienist regularly. That remains to be the case. Those with less money are much less likely to have seen a dental hygienist than those who make more money in their household. We also see across employment status, those that that continue to have full-time work, those that are students, more likely to have visited a dental hygienist over this period than those who are unemployed, freelance, or working part-time. So there is an economic relationship between visits and not. When we ask those who haven't visited a dental hygienist since March why they haven't, we do see a number of factors. The two most prominent are a sizable group, about 1 out of 3 of those who have not visited a dentist, of the 57%, say that they're putting off an appointment that can wait. They don't see an urgency to do it, and so they're waiting. They're holding off on maybe doing some routine visits for cleanings and other checkups with their dentist and dental hygienist. About a third say they're actually hesitant about the safety of dental hygiene appointments. So there is some concern that going to a dental hygienist or going to a dental office is putting someone at risk that maybe they don't feel comfortable doing. And so this underscores the importance of continuing to communicate with your patients about the safety procedures that you're doing, making it very clear what the experience will be like and the efforts you're taking to protect them when they do come for a visit. Other factors that are a little bit more economic based, about 1 out of 10, or 14% say that their household has taken a financial hit and therefore they no longer afford dental care. 12% of those who have not visited a dental hygienist report that they lost dental benefits. So those two, while much smaller, represent a really important factor that underscores the challenge that quite a number of households are facing in just being able to afford or feeling that they can afford the care that they need and should get, as opposed to other priorities, maybe food, maybe rent, maybe other expenses in their lives. Now, among the 43% who have visited a dental hygienist, the vast majority report the experience being, in their minds, safe. 60% say very safe. 30% say somewhat safe. So that's a large number of people. Now, there is a small minority who report feeling somewhat unsafe about the experience, but for the most part, those that have gone, like myself, have felt that they're both dental hygienists, they're dentists. Those on the team have done what they should, distancing ourselves, forcing us to wear masks, having us wash our hands and sanitize before we get in. All of those things, I think, have created a space for those who have visited, a real, I think, positive endorsement for the experience overall. Lastly, we asked people about the quality of care that they received. The question was basically, compared to experiences before the pandemic, was the experience better, worse, or typical of what you would expect? And 92%, again, a very high number, report receiving the same or better care than they would normally receive. Again, another strong endorsement for the experience for the vast majority of patients who've gone to see a dental hygienist over the past 10 or 11 months. And I think underscores that those who have, really very few of them are reporting a negative experience. And so this underscores something to talk about. It does suggest that there are some who are hesitant. Those who are probably more worried about exposing themselves to the virus will continue to perhaps hold themselves back, not visit, but everything that you can do to not only reinforce that the experience has been good, to find ways of perhaps creating some references or referrals that say, my experience at with my dental hygienist was quite positive and safe, I think will go a long way to making people feel comfortable. Given that this pandemic will likely go on for a number of months before the full vaccine rollout happens, I think these results underscore that, one, some folks are not going to the dental office or the dental hygienist as they normally would, that concerns about the virus and exposing themselves to the virus itself is the primary barrier, although for some, financial constraints are a variable that's affecting their choices, but that ultimately those who have gone, the vast majority have experienced a pretty good and safe experience. So I hope these results give you some insight into how patients are feeling, how Canadians are feeling about dental services, and that you will use them to help guide your own work and the way that you've set up your practice to make people feel comfortable and seek and get the dental care that they should and want to get in the months ahead. If you have any questions, obviously feel free to reach out to the CDHA, but you're also welcome to send me a note directly at david@abacusdata.ca. And I look forward to the next time we get to share and maybe see you in person at one of the CDHA's events. Take care and have a great day.